All right. Okay, good morning, everyone, and thank you for joining us for the fifth day of our 2020 AHI Leadership Summit. The theme of this year's summit is Uniting the Future of Population Health and Virtual Care. This is our 12th summit and our first ever virtual. My name is Courtney Shaler. I manage the Adirondack Rural Health Network for AHI. I'm proud to welcome you today on behalf of our CEO, Eric Burton, our AHI Board of Directors, and our staff here at AHI. This morning's presentation, The Expansion of Telehealth During the Transition to the New Normal of Healthcare, a collaborative effort to enhance care delivery during the pandemic, is presented by Paul Hamilton of HCR Home Care and Mark Hasselwander of Hudson Headwaters Health Network. We want to take a quick minute to say thank you to our sponsors who've helped lift this event up over the past 12 years. We wouldn't be here without them, and we encourage you when we're back in person in Lake Placid to visit them at their vendor booths. So I want to take a quick minute to give you a few best practice tips for the summit to increase your enjoyment today. Please confirm that you're muted and your video is off upon entry. To avoid audio issues, please choose either computer audio or phone audio. Using both may result in an echo on the line for you. For optimal viewing, we recommend using the side-by-side mode. To activate side-by-side mode, click on the view option at the top center of your screen and choose side-by-side mode from the drop-down. We also encourage you to use speaker view. That will allow you to see the slides and the video of the speaker at the same time. We also encourage you to use chat freely to submit all questions and comments, and the HI staff will be sure to answer any questions. Also, if you have any technical issues or you want to share any comments with us or the presenters, please put them in the chat as well. All presentations will be archived on the AHI website by October 9th. This includes both the slides and the recordings. Now I'm going to turn screen sharing over to Paul and Mark.
Great, thank you so much, Courtney. I really appreciate that. I am Paul Hamilton from HCR Home Care. I'm a clinical and community liaison, and I interact with hospitals, doctors' offices, healthcare networks, insurances, and a number of providers to help educate on the benefits of home care and how we can serve patients of all of theirs in our communities. And HCR Home Care is in 25 counties. We're just shy of 1,000 employees, and year to date we've had almost 200,000 interactions with our patients in the comfort of their home, and we're really happy to be able to participate today.
Yeah, my name is Mark Hasselwander. I'm the regional practice leader for Hudson Headwaters Health Network. I'm the Northern Region practice leader. My role involves, working with our health center teams, providers, nursing, and front office staff to ensure that, we are providing, optimal patient experiences and care and ultimately improving access to that care. It also involves, like Paul said, working with community partners such as HCR to help us fulfill our network's mission and vision. Just a little bit of background about Hudson Headwaters. We're a federally qualified health center. We have 19 health centers spread over about 5,600 square miles. It encompasses all of Warren County, most of Clinton, Essex, Hamilton, Saratoga, and Washington counties. And very soon we'll actually have 21 health centers and another county added to that list, Franklin, as we are very soon adding health centers in both Saranac Lake and Tupper Lake. We're also the only primary care safety net provider in the communities we serve. In 2019, we saw almost 87,000 unique patients that encompassed about 327,000 visits. So that's a background. And again, very appreciate everyone's time to join and be able to share this with you.
So we wanted to, first of all, share our community-focused mission and values. And HCR Home Care, our mission is to address barriers to independent living through research, education, and programs. HCR enhances services mirroring those communities we serve by fostering home health care practices and identifying new ways to serve those whose independence is challenged. And our vision is all individuals can remain in their homes safely and successfully for as long as they choose.
And at Hudson Headwaters, our mission is to provide the best health care and access to that care for everyone in our communities, regardless of their income, insurance, or ability to pay. Our vision is to pioneer an innovative, sustainable, and community-focused health system through comprehensive primary care and diverse partnerships. So the learning objectives that we want to, that we hopefully achieve during today's presentation is, first and foremost, appreciate the value of innovative use of technology in response to the COVID-19 pandemic. Describe some of the steps we've taken, both HCR and HHHN, to develop and enhance this collaboration. Understand the benefits of the initiative that we undertook to both patients and providers. Maybe learn a little bit. We've got some data we're going to share about some preliminary outcomes for this initiative, including patient satisfaction, as well as hospitalization rates. And then also talk a little bit about, the opportunities that exist for telehealth technology beyond the life of the pandemic.
So the benefits for the patients is really of our program, our collaborative program, is really to be able to have the patient have a comprehensive assessment with their provider within the comfort of their home, and to have the clinicians at HCR help overcome some of those technological barriers by facilitating the providers with visualization of wounds, rashes, lesions. And another benefit would be there's no need to arrange for transportation, which is a very significant barrier for some of the patients that we share. Extended travel times, those that live in those remote areas to get into their doctor's office, a lot of times poses challenges. And especially in the very early part of this pandemic, COVID-related stress of being in public places, and it kind of ties into our next benefit of, that exposure of patients and providers while in the waiting room and exam rooms, and then also having the HCR nurse being able to do some vital signs and an assessment prior to the video interaction, and it leads to very efficient provider interactions for Hudson Headwaters. So a little preview of what our patients are saying. It's beneficial for me because it's hard to get out with an ambulette, and would use it again. Good, because I have to use a wheelchair to get out, and it's really difficult. One of our patients said, I couldn't use the smartphone, so I found it really helpful to have someone to help. And yet another, it's good because my son doesn't have to take time off from work to bring me. And finally, it was great having the nurse there because she helped me explain things that I didn't understand, which is really the benefit of home care, and one of the leading roles is for education around a lot of their health diagnoses and conditions.
A little bit about the video visit evolution that we had at Hudson Headwaters. I put in, if there is such a thing, maybe a silver lining to this pandemic. But for prior to March 15th, our total number of video encounters were 0. Obviously, we didn't have really any type of platform spun up to do any of these. And as we all know, reimbursement had always been an issue. So, but very quickly we saw that we needed to do something. So the weekend of March 14th and 15th, it just seems like yesterday, but over more than 6 months ago now, our leadership team met over the weekend, developed some workflows to ramp up telehealth visits. We selected Zoom as the technology platform. So that first week we we did a sort of a centralized model where we brought providers, dedicated nurses, as well as front office staff into our offices, our administrative offices in Queensbury, to perform video visits on dedicated terminals. Helped us kind of, iron out some of the bugs in the workflows that we needed to do, and we were able to do 11 video visits. But obviously, we knew that that was not sustainable, and we needed to ramp this up very quickly. Move to the decentralized model where we could do these telehealth visits at each one of our health centers. So obviously the challenge to that was, obviously brand new, technology. Perhaps some people had used Zoom in the past, but now it's a verb and a noun that everybody knows in our vocabulary. But back then it was new to patients, new to staff. So part of our workflow was, prior to the day of the visit, our front office staff would contact the patient, kind of walk them through the download of the Zoom app if they were going to use a smartphone or a tablet, and also if they're going to use a computer, how to set up the computer using the Zoom website. So try to work out those kinks before actually the day of the visit. At the time of the visit, the nurse would then, call the patient with a Zoom meeting number and password, get connected to Zoom, do their intake before the provider would join to conduct the actual encounter. Obviously the benefits for this, the new platform allowed those patients, like Paul said earlier, at higher risk, those with, routine follow-up visits that didn't necessarily need to come into the center to potentially, to keep them safe, to keep our staff safe too. And, obviously those with transportation barriers to still be able to connect with their provider, not break any continuity of care. Our patients and staff became, comfortable with the new formats and workflows very quickly. And you can see by this, and I apologize for the over busyness of this slide, but you can see that first week we had done 11 video visits. Like I said, that was 0.3% of our overall visits, that week. That first column over to the right there, where under telehealth, that was the percentage. Telehealth is kind of the combined telephonic visits as well as the video visits. So you can see that first week, just over a third of them were video, the other were telephone. But then you can see how quickly we ramped up. By the first week in April, over a quarter of our visits were being done via telehealth, and over half of those were being done by video. And when we got into the middle of April, end of April, we were at a third of our visits being done, via telehealth, and then 2/3 of those being done by video. And you can see that percentage kind of, stayed pretty even because there were some other technology, barriers that occurred that sometimes we had to default to telephone. But yeah, that's kind of, when we got involved with HCR, because they could certainly help break down some of those barriers. You can see, as we got towards, June, and as we've gotten into July and August, that has come down a little bit as people have become a little bit more comfortable with, the wearing of masks, social distancing, and coming into the health centers. But the video, you can see the video visits have stayed pretty constant at 2/3. Obviously, I just talked about some of the barriers to the video encounters. Our service area is very rural in places. It essentially encompasses, most of the Adirondack Park and points south, a little bit south of that. But some of the barriers are broadband access in our service area. There's simply some places that don't even have the ability to have broadband. We've got lots of patients that, even if they had access to broadband, can't afford it. We've got patients that might not have the necessary devices in order to hook into there. And then, if they do have those devices, if they do have access to the broadband, we still have patients that maybe lack the necessary technology savvy to do that. So those are some of the reasons where the providers would kind of have to default to telephonic visits, which obviously doesn't provide, nearly the same level of care to patients, and also significantly lowers reimbursement. So a couple of things we've done to try to get around that is that we've partnered with some of our internet providers to have hotspot access in our parking lots to enable a visit. If a patient doesn't have broadband at home, they can actually come to our parking lot and they have that. We can do video visits from there. We've done that up in our health centers in Champlain, Plattsburgh, and Ticonderoga, as well as down in the Glens Falls area at our health center on Broad Street. But that still doesn't solve for those homebound patients. If they're homebound and have other barriers, that doesn't solve for that. So that's kind of where the HCR Hudson Headwaters partnership kind of evolved to overcome those other barriers.
So the HCR and Hudson Headwaters knew that we were going to have kind of this time of innovation and collaboration to help solve some of these problems of patients that were in their home but not able to or not willing to get out to their doctor's offices, and we'll see a little bit later how that kind of affects their health. But we had to initially say, like, what are we trying to accomplish? And it's we had to develop a strategy for HCR to facilitate and educate those patients in their home at the same time that they're having a telehealth video visit with Hudson Headwater. And it took enormous amounts of coordination, and we had to have a point person within Hudson Headwaters and a point person with HCR and direct phone line access to help kind of triangulate when everybody would be able to be in the same spot at once. And we needed direct line access. So there was in each of the centers, we had a direct line to the person that would be able to help coordinate all of that. And another one of the things that had to happen was all of our clinicians at HCR had to have technology installed on their devices to help interface with the Hudson Headwater offices. And because of a lot of the geographical overlap, we wanted to make sure that even though we're starting in the Champlain office, that it was scalable across our overlapping footprint. So the process prior to the visit, how it developed was, as I mentioned, the HCR and Hudson Headwater provider would establish that an appointment is to be made, and then we would reach out to kind of triangulate when everybody would be able to be in the same place at the same time. And then Hudson Headwater would communicate the Zoom login meeting information to the clinicians from HCR so that we can log in. And then Hudson Headwater also would, as Mark mentioned earlier, call to verify patient demographics, insurance information, and other verifications that they needed from their side. So during the visit process, HCR clinician would show up before the visit needed to be started and do a general assessment, collect some vital signs, and then the HCR clinician would help provide education and facilitate setting up of that the device for a Zoom meeting. And then the Hudson Headwater nurse on that side would log into the Zoom meeting, obtains a detailed history and interview for their process. And once the nurse was complete with their portion, the Hudson Headwater provider would complete their portion of the meeting, and the HCR clinician would be right there in the home and present and able to help, say, visualize wounds that might need to be visualized, or explain some medications or diagnosis or instructions that needed some clarification to the patient. So.
Yeah, this is just a quick overview of our geography for both of our organizations. You can see that, on HCR, that the northeastern corner of New York, overlap there. That region for them overlaps very nicely with our service area on the right there. Once we've kind of refined this process, the expansion is possible to more offices. We started in Champlain, which is at the very top there, right by the Canadian border. Expanded that down to Plattsburgh, and now we're starting to implement this in Essex County. Essex County is probably the most challenged county in terms of some of those access issues, whether it be broadband access, whether it be just the sheer distance to get to our centers in Ticonderoga or Mariah or Scruton Lake for that matter. So as Paul mentioned, as we continue to refine this process, we look forward to expanding this further.
So there are some known factors across home care and that are very relevant to our project together and our collaboration. So patients who are homebound are at higher risk for hospitalization. So patients that are homebound obviously have very complex diagnoses. They have a lot of comorbid conditions, difficulty ambulating, difficulty transferring, and have various, social determinants of health that affect their healthcare and their ability to, or their health and ability to access, healthcare as a whole. Patients who are able to achieve office visits with their primary care provider have higher rates patients who are unable to achieve their office visits with their primary care provider have higher rates of ED visits and admissions. And we actually have some data that kind of points in that direction as well. But also patients that participated in our collaborative program also had lower admission rates compared to the HCR regional patient population that weren't able to participate. So that's kind of explained by what we have going on here. So this is the acute care hospitalization for HCR. And acute care hospitalization is a little bit different than rehospitalization. Rehospitalization is coming from a hospital system, going home and then being rehospitalized. Acute care hospitalization captures those patients that are in home care that didn't necessarily come from a hospital organization. They can come from a variety of different places. It could be a doctor's office, it could be a skilled nursing facility. It could be a lot of different sources that have made referrals for home care. And the baseline for HCR in this region is about 15%, which is very typical for home care agencies. And we found that during the pandemic, the acute care hospitalization rate in the area jumped up to 21%. And some of the things that we were thinking that really makes a difference is these patients were not accessing their doctor's offices. They're foregoing a lot of their appointments. Outpatient physical therapy appointments were foregoing. Actually, as a home care agency, people were very panicked and weren't letting our own clinicians come in and seeing them because everybody was scared, especially in the very early time of as the pandemic was kind of unrolling. And a lot of family supports that were helping guide care and identifying some subtle symptoms had fallen. The bottom had kind of fallen out of their entire support network. So we saw this increase to 21%. And then our acute care hospitalization with those that were participants in our collaborative program, where they could have access to their provider, and they could have access to their home care agency. We saw the acute care hospitalization being 14%. So reduced from 21% down to 14%, about a third less, or 33% reduction in hospitalization admissions by participating in this program and having those kind of wraparound services that can help identify and treat symptoms very early. So an unexpected benefit that we saw as well from this collaboration was the amount of time that it takes for home care orders to be sent, signed, or reviewed, signed, and returned by providers. And across the HCR and in Clinton County, we find that it's around 7 days, maybe a little bit less than 7 days to get the paperwork back and kind of turn around. But for this HCR and Hudson Headwater program, those patients that shared within it had a much reduced, less than 4 days to get the paperwork back. And we believe that's because the providers that are signing these orders, reviewing and signing these orders, are very intimately aware of what's happening in the home because of this collaborative meeting of the minds with the patient. And even one of the nurses was showing kind of what the home care environment looked like to the provider, so they could get an even a greater depth of understanding of how the patient is living and in what environment that they're living.
So we thought it was important about 6 or 7 weeks ago to kind of get some feedback from all the constituents that are part of this, and obviously that included our providers in Champlain and Plattsburgh at the time, and asked them three questions. We did it anonymously. They had the choice to do it anonymously anyway. But the first was around scheduling convenience. Please rate the convenience of coordinating an appointment time for a telehealth visit with your patient and the HCR clinician. And everyone answered 5 stars. Out of a scale of 1 to 5, 5 being very convenient. As far as the quality of the experience, how would you rate the quality of the overall experience coordinating care with HCR home care for your patient's telehealth visit? Same thing across the board. Everyone rated it 5, very high quality. And then, lastly, based on your experience, please rate the likelihood of continuing to coordinate care with HCR for your patient's telehealth visit, even post-pandemic. And again, across the board, the mean response there was straight 5s. So I think that kind of goes to that last bar graph that Paul showed, how quickly our providers were signing orders back to them, knowing how good this was for the patient. We also asked for some comments and verbatim feedback. You can see it, and providers can be a tough group to sometimes I think they're rightfully so can be critical at times. So you can see here that HCR has been a pleasure to work with during the pandemic. They've made access to care much better for patients who are homebound and unable to come into the office due to weakened immune systems, or patients who need interim follow-up visits in the office. They've been a great help with drawing blood work. Irene, who is one of the HCR clinicians, has been wonderful to work with. Scheduling has been a fairly smooth process. I've had 0 to few issues with Zoom working on their end as well. I hope we can continue this post-pandemic. Again, we did this 6 or 8 weeks ago, and we started up in Champlain. So we had this one feedback from Plattsburgh. It seems it's not as convenient for HCR nurses. They're not sure if they're not as inclined, to help with this. So we kind of took this feedback. used the feedback to ensure that the team at Plattsburgh, as well as the HCR nurses, that covered that kind of little bit more southern portion of Clinton County, understood the workflows. Our practice leader up in Champlain, kind of worked with our team down in Plattsburgh to make sure that that everyone was on board with this and understood the workflows, and think that we solved for that up in Plattsburgh as well.
So HCR wanted to see what the clinicians' satisfaction was as well. And the scheduling convenience, 4.2 out of 5 stars, which is very high. And if you can imagine, these are clinicians that in the rural areas are traveling very long distances. And if they have to be to somebody's house at 11 o'clock, they have to plan things around and move visits around and kind of adjust how their day is, but still, very easy to help, schedule. The quality of patient and physician collaboration, 4.8 out of 5 stars. And really, this speaks to, I was a clinician in the field as well. And to be able to have a doctor or provider, in direct contact with them while you're in a patient's home is invaluable. And it makes for very efficient interactions. You can help visualize a wound or help visualize something or explain something, and have the provider making real-time changes to what the course might be, or they might be able to say, okay, I'm going to call in this medication to the pharmacy, and the HCR staff knows that kind of immediately. And then overall satisfaction was 4.5 out of 5 stars. So absolutely great feedback from the clinicians. And we again took some of the verbatim feedback from our HCR clinicians, and they had said very helpful to get patients seen during the pandemic. They understood a lot of those challenges as well, and we were seeing it firsthand, kind of boots on the ground. And would be great to have available after the pandemic, which really speaks to them acknowledging that some of these barriers aren't specific just for the pandemic, but but the pandemic has been able to allow us to grow into that area, that to identify those barriers and help overcome them. So great option for those that are too sick to leave the home or have transportation issues. Another one of our clinicians, time for each visit can vary from patient to patient, and cell service can be spotty in some areas. So, as Mark had kind of alluded to earlier, that, cell phone service, there are some of these barriers that will not be able to overcome, but, the majority of our areas, we have an acceptable cell service, and we're able to help, and facilitate as needed. And then, as we talked about earlier, one of the clinicians identified very efficient talking directly with providers. So it really speaks to the HCR clinicians seeing the value in this as well. And then certainly we don't want to leave out our most important part of the entire puzzle is our patients and their satisfaction. And scheduling convenience is 4.6 stars. And, these are patients that don't routinely leave their home, and, are kind of very accepting of any time that we're able to coordinate a visit. They're typically very available, unless there's any other types of conflicting appointments. But so the scheduling convenience for them, 4.6. The quality of care, 4.6 as well. They're very happy with being able to have the provider and the clinician there kind of at the same time. And then overall satisfaction was 4.7. So it really speaks to their satisfaction for the entire program as a whole, and kind of speaks to the value that they see in it. So some more of their feedback, we gave you a preview earlier, but I'm bedridden and this makes visits possible with ease. So, that this is kind of like our patient population that has such a difficult time. Another wife of one of our patients, it's really great because my husband has dementia and doesn't do well going outside of his comfort zone. And if you can even imagine during COVID-19, this comfort zone likely has narrowed even more because of dementia and the added stresses of COVID. Yet another one of our patients, I think we got more accomplished with the HCR person speaking directly with the doctor during visits. And kind of that collaborative approach is really valued by the patients as well. And I appreciate everything they did. The doctor was thorough and he didn't feel rushed. So really great feedback. And then, lastly, due to mobility, the telehealth is better. And it really does speak to the value and exactly what we're trying to accomplish, in COVID, had this pandemic, as the pandemic was unfolding, is to help remove some of those barriers, and mobility are certainly one of them. So
we talk about, using video visits going forward, whether continue as we continue through this pandemic and even beyond that. But first, one of the things we've seen, especially starting in July, is we've experienced a big uptick in patients returning to the office for visits. And I think I said earlier, people become more comfortable with the protocols of wearing masks and social distancing. But we also, obviously, in the time frame of the spring, a lot of visits, certain visits were put on hold. Those that really need to be done in person. Another reason for the uptick. But one of the challenges we have, though, is really kind of figuring out when is it best, kind of figuring out when it's best to have an in-office visit versus a video. So one of the things we do is we use kind of the standard screening questions when a patient calls to schedule a visit, to help determine which might be right for them, if perhaps a video visit might be more appropriate. Those screening questions are also repeated before they come into our center. And obviously, if they fail one of those questions, we strive to see them outside. In several of our centers, we have tents or structures to facilitate that. Again, we've also talked about we can even set up a video visit outside if needed, or schedule a future video visit. We've also developed a COVID-19 risk score for all of our patients, just to provide another data point for the provider and the teams to decide maybe a video visit might be a better choice for the patient. The risk score is not a risk score of them contracting COVID. It's their risk of coming down with complications, more severe complications if they were to contract COVID-19. But then again, with the possibility of the fall surge and now that we're in the cold and flu season with all the different symptoms that kind of mimic each other, video visits are going to be really integral in keeping patients safe, but also allowing us to patients safe and our staff safe, but also maintaining access for necessary in-person visits. So, we've had a real kind of point of focus over the last several weeks to really kind of to look where we can schedule those more routine follow-up visits via telehealth, so we have that capacity to see sick visits in person. One of the things, as I said earlier, if there's a silver lining, was the hugely accelerated evolution of the video visit. Again, to that end, we took those steps. But one of the things we saw that with using the Zoom platform, we want to continue to improve the experience for both the patient and the provider. With Zoom and the particular EMR that we use, force the provider to kind of toggle between the two screens, the Zoom screen and the chart. So, what we've done We've developed a different platform where it's going to be much easier for any patient, certainly for the HCR team, to use this new platform we have, which is an app that they'll have on their phone or tablet or computer, where they can very easily just click on a link that we send them, and they'll be able to join. And then again, the provider will have that patient on the same screen as the charts. We've had a couple of technical challenges, and really involved being able to send an email link to a third party to launch the visit. And we've overcome that now. We have the ability to do that. So we're going to be working together, Hudson, Headwaters, and HCR to get that technology downloaded to the HCR clinicians. It's also obviously going to be very beneficial that with the ability to send a third-party email outside of this whole collaboration, just to, many patients when they're doing telehealth, they might want to have, their care provider, their provider at home, whether it's a parent or someone who might not even live in the same house or the same state for that matter, be able to also join that encounter as well. So, but obviously, beyond the pandemic, as Paul already alluded to, telehealth, for all those, homebound, bedbound, ambulatory, challenged folks, those that are immunocompromised, the huge transportation barriers that we have, whether it's distance related or just the ability to get transportation to get to the office. Telehealth is, like I said, if there's such a thing of a silver lining coming out of COVID-19, I think that's a big one. So that's it.
Okay. All right. Hi, thank you, Mark, and thank you, Paul, for that presentation. I do have a few questions. What regulatory flexibility granted to the telehealth world do you think was most beneficial during this partnership?
I think it was just the acceptance of the ability for us to bill for these visits. That's obviously an important part of this, and kind of the restriction on that. The other thing that seems to be loosening up, a lot of the telehealth visits, at least to my understanding, had to be done within the health center itself. It's being a little bit. You can kind of think maybe of a provider that perhaps has to be quarantined for perhaps possible exposure. Will still be able to do video visits from their home or off-site, and I think that has been relaxed as well. So I think those are, at least from our end, Paul.
Yeah, and the same from a home care side is those visits that the providers are able to accomplish because of the relaxed guidelines, and that actually helps home care and helps the patient in the home, and allows us the opportunity to facilitate and educate around that.
Follow up to that, which flexibility would you like to see remain beyond the public health emergency?
I think it's just that. I think it's I think it's the ability to treat these visits as an in-office kind of visit, when it comes to the ability for the patient to do that, and for the providers in the different networks and offices to get paid for them.
And actually, to add to that, I think that it's a lot of these very rural patients that have struggles to get to their provider's office. Going forward, if that is still a reimbursable visits for the providers, it'll provide extreme value for those patients that don't necessarily need a in-person visit, but having the ability to connect virtually with their providers can certainly is an extreme value.
Thank you, Paul. There's a question, Mark, this one's for you. Who is your EMR vendor that allows you to integrate a new video platform?
Yeah, so our EMR vendor is Athena, Athena Health, and so we've used a platform that's kind of like an add-on, and the name of the app that we're using, the company that we're using, is Cure for You. So that allows with an overlay for that to be integrated into our EMR.
Okay. If you have any other questions, please put them in the chat now. I did get a question privately to me, Mark, about, you talked about what patients would be a good fit for telehealth. What if the patient's personal feeling is that they would prefer telehealth?
If they prefer telehealth?
Yeah, so say like even though they don't have maybe an ambulatory challenge or a distance challenge, but as a patient, they would be more comfortable than coming into the health center. How is that handled?
Oh, sure. And, we do that. We do that all the time now. I talked about the COVID-19 risk scores, so that, they may not, have any of the other barriers, whether it be, technology or transportation or ambulatory. So, we can, again, that's something that we use if they're, reluctant to come in, whether, for possible exposure, we can do those. And even frankly, just for anybody that doesn't have any of those challenges, one of the things that we're going to need to do, if we have another big surge, is to keep capacity at the health center, because it could involve, if you're bringing somebody that has to come into the center and they're sick, involves shutting down rooms for a couple of hours if that might be the case. And so that's really going to limit capacity, especially in some of our smaller health centers that we have throughout the network. So, like I said, we're proactively, reaching out to patients where, kind of a visit, a routine follow-up visit or medication check kind of visit that we can do routinely. So.
Okay, great, thank you. And then this is for both of you. Have you administered satisfaction surveys before telehealth? If so, what are your comparative findings?
Well, we do satisfaction surveys with pretty much every, CAP surveys with, every kind of patient that visits our centers. We don't get a big response rate on those, but I don't think it's kind of a real apples to apples comparison. We do in our centers also have, we've kind of suspended it during the pandemic due to, infection control. We have a machine that asks, very similar to that last question we asked in all the surveys that we did, the provider surveys, the clinician surveys at HCR, as well as the patient surveys, about your overall satisfaction, known as a net promoter score. And, right before, the pandemic hit in our network, we were averaging, about, 78 to 80 on our net promoter score. And the question asked was, rate your experience, would you recommend Hudson Headwaters to a friend or family member? So I think that, those are pretty comparable to what we were seeing. Paul?
And from HCR, again, we actually do patient satisfaction surveys and have a lot of quantifiable data, and how likely are you to recommend to friends or family. And again, I think that I don't have the data right in front of me, but I think that they are very comparable to the satisfaction with the telehealth portion from home care, and maybe even the telehealth is more convenient for them, during this pandemic. So.
Okay. Thank you, Paul. Thank you, Mark. I'm going to ask you, we'll start with you, Mark. Do you have any closing thoughts before we end today's session?
I just want to thank everybody to take time out to listen to our presentation. It's been a great collaboration, and ultimately it's just really enhanced patient care for some of those patients that need it the most. And so that's really it.
Okay, Paul?
Great, yeah, thank you. And similarly, thank you so much, everybody, for joining us. Thank you to Katie and Rebecca, Sarah, Courtney for setting this up. I know there's been a lot of challenges in allowing everybody to continue to have this very important summit and meeting is really great. And I guess thank you obviously to Hudson Headwater for continuing to partner and collaborate with us, the ultimate benefit of our patients. And maybe in the way of telehealth, I actually think that this technology that's being integrated into our most rural areas are going to be imperative moving forward, because patients are being sent home from hospitals and kind of those rehab facilities with more and more complex issues. And we have HCR has technologies for remote patient monitoring, and we have some automated calling systems, and a lot of those things that help identify early so that we can intervene early for any exacerbation. So I think that these video visits with the with Hudson Headwaters and all of it collaboratively together is going to help provide the best patient care in our most rural areas.
Well said, Paul, I believe as well. I want to say too, Shirley put in the chat, thank you so much for a great session. I'd like to thank everyone who participated in this 2-week learning symposium of the North Country Telehealth Partnership and the AHI Leadership Summit. This concludes our final session. We will be sending out a survey. Please tell us what you think. We know we pivoted very quickly to virtual, so we're looking forward to hearing those survey results and planning the 2021 events for you. Thank you, everyone. Have a good afternoon.
Thank you.
Thank you.